All right. I'll call to order this session of the Scotch Plains Family Public Schools Board of Education meeting. Welcome to our annual organization meeting this evening. We will start with calling the roll. Ms. Laurel.
Here.
Mr. Murray. Here. Ms. Mitchell.
Here.
Ms. Soriani.
Here.
Ms. Winkler.
Here.
Thank you. Please rise for the Pledge of Allegiance. I pledge allegiance to the flag
of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
The New Jersey Open Public Meeting Law was enacted to ensure the right of the public to have advance notice of and to attend the meetings of public bodies at which any business affecting their interests is discussed or acted upon. In accordance with the provisions of this Act, the Scotch Plains Family Board of Education has caused notice of this meeting to be public by having the date, time, and place thereof posted at the Board of Education offices located at 512 Cedar Street, Scotch Plains, New Jersey. Such notice was also provided in written notice forwarded to the Times, now known as the Union County Law, the Star Ledger, and the Township Clerk of Scotch Plains, and the Borough Clerk of Danvers, in the revised annual notice of regular scheduled meeting as adopted September 1st, 2021. At this point, I would like to read into the minutes the election results from this past November. We had 6 candidates run for 3-year open positions, all on the Scotch Plains side. The town casted 9,384 votes from a total of 19,310 registered voters. The vote tally was as follows. Aaron Kulikowski, 3,550 votes. Deborah Brody, 3,606 votes. Tanya Y. Williams, 3,453 votes. David Levine, 3,255 votes. Timothy J. Neal Jr., 2,593 votes. And Michael R. Gromek, 2,176 votes. I ask that Ms. Brody, Dr. Kulikowski, and Ms. Williams come to the board and join me in the center of the floor for the oath of office. Raise your right hand and repeat after me. I state your name, do solemnly swear
I, Aaron Kulikowski, do solemnly swear
that I will support the Constitution of the United States
that I will support the Constitution of the United States
and the Constitution of the State of New Jersey,
and the Constitution of the State of New Jersey,
and that I will bear true faith and allegiance to the same
and I will bear true faith and allegiance to the same,
and to the governments established in the United States and this state,
and to the governments established in the United States and this state,
under the authority of the people,
under the authority of the people,
so help me God.
so help me God.
I state your name, do solemnly swear
I, Aaron Kulikowski, do solemnly swear
that I possess the qualifications prescribed by law
that I possess the qualifications prescribed by law
for the office of member of the Board of Education,
for the office of member of the Board of Education,
and I am not disqualified as a voter pursuant to RS 19:4-1,
and I am not disqualified as a voter pursuant to RS 19-1,
nor disqualified due to conviction of a crime or offense listed in New Jersey Statute 18A 12-1,
nor disqualified due to a conviction of a crime or offense listed in NJS 18A 12-1,
and that I will faithfully and impartially and justly perform
that I will faithfully, impartially, and justly perform
the duties of that office according to the best of my ability.
all the duties of the office to the best of my ability.
So help me God.
So help me God.
Congratulations.
Thank you.
I now ask for nominations for President of the Board of Education.
I'd like to nominate Karen Polkowski.
Yes, second.
Yes, I would
Are there any other nominations? Hearing none, the nominations are closed. We will perform a roll call vote on the nominee. Dr. Kulakowski, are you willing and able to fulfill the obligations and duties of president if elected?
Yes, I am.
Call the roll. Mrs. Borla,
Yes.
Ms. Brody,
Yes.
Dr. Kulakowski,
Yes.
Mr. Mitchell,
Yes.
Mr. Murray. Yes. Ms. Soriano,
Yes.
Ms. Williams,
Yes.
and Ms. Winkler.
Yes.
Motion passes. I will now hand over the gavel to the President of the 2022 Board of Education, Dr. Lee.
Thank you, James. Thank you, board members. Thank you, everyone. I appreciate you coming here tonight, and thank you for your confidence and vote for this president. So then at this time, we need nominations for the office of Vice President of the Board of Education. I want to nominate Evan Murray. Thank you, Mrs. Laura. Second. Thank you, Mrs. Brody. Evan, do you accept the nomination? James, would you please call the roll for a vote for Vice President for Mr. Murray?
Ms. Laura,
Yes.
Ms. Brody,
Yes.
Ms. Mitchell,
Yes.
Mr. Murray. Yes. Ms. Soriano,
Yes.
Ms. Williams,
Yes.
Ms. Winkler,
Yes.
Dr. Kulakowski.
Yes. Motion carries. Congratulations. Thank you. Okay, next we move that the Board of Education pursuant to the New Jersey State Statute, Chapters 1 and 2, Title 3, relating to newspaper publication on legal public notices, officially approves the Union County Hall, Star Ledger, and the Alternative Press, known as TAP, as the official publications for all district official legal public notices for the remainder of the school year. Can I have a motion? Thank you, Mrs. Winkler. Thank you, Mr. Murray. Any question or discussion? All those in favor? Aye. Okay, motion carries. Move that the Board of Education adopts the policies and rules and regulations currently in effect in the policy manual, and B, the school district curriculum as previously approved by the board. Can I have a motion? So moved. Thank you, Mrs. Soriani. Is there a second? Second. I think I heard Mrs. Laurel first. And Mrs. Winkler. I think you should raise your hand when you say your name. I can't tell the voice difference. Okay, thank you, Mrs. Winkler. Any question or discussion? All those in favor? Aye. Any opposed? Motion carries. Number 7, move that the Board of Education reviews and adopts the New Jersey School Board's Member Code of Ethics, which I have right here, and I'd just like to read it. A, I will uphold the office and enforce the laws, the rules, and regulations of the State Board of Education and court orders pertaining to schools. Desired changes shall be brought about only through legal and ethical procedures. B, I will make decisions in terms of educational welfare of children, and I will seek to develop and maintain public schools that meet individual needs of all children, regardless of their ability, race, creed, sex, or social standing. C, I will confine my board action to policy making, planning, and appraisal, and I will help to frame policies and plans only after the board has consulted those who will be affected by them. D, I will carry out my responsibility not to administer the schools, but together with my fellow board members to see that they are well run. E, I will recognize that the authority rests with the Board of Education and will make no personal promises nor take any private action that may compromise the board. F, I will refuse to surrender my independent judgment to special interests or partisan political groups which use the schools for personal gain or for the gain of friends. G, I will hold confidential all matters pertaining to the schools which, if disclosed, would needlessly injure individuals or the schools. In all matters, I will provide accurate information and, in concert with my fellow board members, interpret to the staff aspirations of the community or its school. H, I will vote to appoint the best qualified personnel available after consideration of the recommendation of the Chief Administrative Officer. I will support and protect the school personnel in proper performance of their duties. And J, I will refer all complaints to the Chief Administrative Officer and will act on these complaints at public meetings only after failure of an administrative solution.
So moved.
Thank you, Mrs. Winkler. Is there a second?
Second.
Thank you, Mrs. Brody. Are there any questions or discussions on the Code of Ethics? Seeing none, all those in favor?
Aye.
Any opposed? Motion carries. Number 8, move that the Board of Education elects a member for the Board of Education as delegate to the Union County School Boards. This delegate is authorized to attend any and all meetings. And I believe that the person who is currently serving, Mrs. Winkler, you are interested in continuing in that role. Was there anybody else that wanted that role? And Mrs. Winkler will continue in that. All those in favor?
Aye.
Any opposed? Congratulations, Mrs. Winkler.
Do you need a motion? I open the bid.
I thought it was Mrs. Brody.
No, that was accurate.
Excuse me, Winkler was the motion mover, then the second will be Mrs. Bloor. Thank you, Mrs. Bloor. All those in favor?
Aye.
Mrs. Bloor, congratulations. Move that the Board of Education elects a member to serve as the delegate for the New Jersey School Board. This delegate is authorized to attend any and all meetings. And also, I believe that Mrs. Bloor, you are currently serving in that role, and you did intend to continue in that role.
Right.
So there was anybody that was interested in that role?
I'll move that Andy continues in that role.
Okay, thank you. Thank you, Mr. Murray. Thank you, Mrs. Winkler. Any questions or discussion? All those in favor?
Aye.
Congratulations, Mrs. Bloor. Number 10, move that the Board of Education elects a member of the Board of Education to serve on the Union County Educational Services Commission Representative Assembly. This delegate is authorized to attend any and all meetings. And currently, Mrs. Brody, you serve on that, and you are interested in continuing in that role?
Yeah, thanks.
Anybody else interested in that role? Seeing no one, do we have a motion, Mrs. Brody?
So moved.
Thank you, Mrs. Williams, a second.
Second.
Thank you, Mrs. Winkler. Any question or discussion? All those in favor?
Aye.
Any opposed? Congratulations, Mrs. Drummond. And thank you to all of you who are serving and representing for those committees. So that brings us to our public comment portion. In accordance with the Scotch Plains Family Board Public School Bylaws 0164-0165, the meeting will be open for 15 minutes for public comments. maximum of 3 minutes per speaker. Speakers addressing superintendent items, business functions, or other board business will be heard first, and if time remains, speakers may address other board matters. Speakers, slowly and clearly state your name and the town in which you reside when you come to the podium. Please note that board members cannot respond regarding concerns of individual students or staff members. Such matters should be addressed with the superintendent's office. So if you'd like to make a public comment, please come up to the podium at this time.
Hi, can you hear me? My name is Kristen Riefler and I reside in Fanwood.
Thank you.
I am here tonight as a mother and as a healthcare provider of 17 years. I have kept quiet with my concerns over the last year. However, as we approach the 2-year mark of the pandemic, it seems our district is moving backwards. I understand there's been a significant surge in the Omicron variant. However, research and facts have shown that children are not the vulnerable population. All adults and children age 5 and older have access to vaccination and a booster to protect them from COVID. Viruses have been around for decades and always peak in the winter months. Influenza, RSV, croup, just to name a few. Children require hospitalization every year for these viruses, some requiring more intense care than others. My 9-year-old was hospitalized several times during his life for RSV and viruses that exacerbated his reactive airway and required intensive care. Schools have never been shut down or treated our children like we're treating them now. Why are we making them sit on the cold concrete floor outside to have snack in these extreme temperatures? Forcing them to shove snack down their throat in 5 minutes so the next group of prisoners can get outside for their snack? What about the children with special needs, such as my son? Some have fine motor issues and need a good 5 minutes just to open their packages, let alone have time to eat their snack. Why can't the children be in school full day like other districts in New Jersey and other states? Or why are we telling them that they can't talk to their friends, they can no longer take mass breaks inside as a result of the new COVID rules? My high schooler got yelled at in the hallway because she was taking a sip of her water bottle. My 1st and 3rd graders got yelled at recess to put their mask on outside while running around, despite both of them having a doctor's order with a nurse's note saying that they have asthma and that we don't want them to run around with masks outside. And this issue has been addressed with the nurse and with the lunch aides. Does anybody here eat outside in the cold winter months or go 5 to 6 hours without taking a drink from your water bottle all day? Or does anybody fast during the day, like you'd expect our children to do if the weather doesn't permit them to snack outside? It just seems like there's so many inconsistencies throughout the schools in the district. The last 2 years, we've accepted more harm to children in exchange for less harm to adults. The American Academy of Pediatrics declared a national state of emergency in children's mental health. The number of suicide attempts has risen by 51%. Children have fallen behind in school and are still struggling to catch up, especially those with IEPs, like one of my children. Being social with peers is so vital to their developmental milestones. I understand it was necessary to shut schools down in the spring of 2020, but we're going on 2 years now. When my teacher friends and families in other districts see what Scotch Plains is doing, they're appalled. Surrounding school districts are able to continue full day as well as allow the kids to have snack and lunch indoors. Why in such a wealthy and smart district can't we safely navigate this? As a nurse practitioner, I also feel compelled to address the N95 mask suggestions. Healthcare providers, including myself, are fit tested every year for N95 masks. It's vital to be fit tested so that the N95 can be effective in protecting airborne illness. We're encouraging children as young as, I'm almost done, 4 and 5 in public school, why? To wear an N95 mask. Do you guys plan on fit testing all the teachers and all the children so that these can be effective? The hospitals are not overwhelmed with COVID. Every patient that walks in the door, whether it be a fractured arm or cancer treatment, is tested for COVID. If that test is positive, the admitting diagnosis then becomes COVID and not the original diagnosis of a fractured arm. I know people are scared and I understand that, but I also want to share what's actually occurring in the healthcare system. It's really easy to make decisions for our children when you don't have any young children who are affected by this. I was born and raised in Scotch Plains along with my entire family, and I'm just disgusted that I ever moved back here to raise my children in this district. Thank you.
Thank you for your comments, Ms. Baker. Is there anybody else that would like to make a public comment? Oh, yeah.
Just a point of clarification, the district has been open full days and we are eating lunch this year. So
We're not
I'm
open
not
full
quite
days right
sure
now.
where that came from. So, you know,
We're not open full days
let's
right
be
now.
clear on the facts. Thank you. It's my turn now. Thank you. So my children are in the district, as other board members' children are as well.
Children in the district.
So, you know, we could talk about 504s as well, because I'm impacted by that as well. So I'd just like to make sure that we're clear, you know, the school district has been open full days. We're only open half days this week. We've been open full days all year, and we've been having lunch in the building. And my high schooler who's sitting there, who comes to every board meeting because he's interested, has been eating hot lunches as well.
Why couldn't they eat snacks
So-
this week then?
You know,
Why
listen,
couldn't they eat in the building
this
this week?
isn't, I'm not, we're not
No, I
allowed to
know.
do this back and forth. If you have a question, you can come up. I'm just trying to re-clarify for the public that we are not closed and not doing half days this year. So,
We are not sure for that.
and there are children in the district, by board members that are sitting around this table.
Dr. Kulikowski, I'd like to just add. So certainly the week after the break, we did make a shift to have the single session days. And it wasn't unusual in neighboring districts. In fact, some of our neighboring districts went fully virtual. Part of the reason we did that is because the transmission rate was so high and the number of staff members that were impacted made it really challenging for the full days. And at the same time, in our conversations with the Department of Health, in order to just maintain the level right now, we know that the transmission rate is very high. And in fact, everyone here is probably a close contact. So part of what we all need to do is to monitor our symptoms so we continue to move forward carefully. But we wanted to be consistent since we weren't going to engage in eating lunch and removing our masks, that the elementary principals wanted snack to be somewhat controlled. We didn't want kids eating outside in sub-freezing temperatures, and we have had that conversation. But I do think, you know, every day we will continue to move back towards normal. So I think that, though right now, also recognize that it remains high, and we monitor it every day. Next week, our intention is to be back full day.
Thank you, Dr. Moore. Our next public comment?
So I'm Anthony Carter, Fenway, New Jersey. And I want to congratulate Tanya and Karen on being reelected and stepping up, taking time from your family and your loved ones and yourself to serve in what can often be a thankless position.
Thank you.
And especially during this time, what's happening just in the world in general and locally with COVID and that stuff, it would have been probably easier for you guys to say, you know what, now's the time for me to pack it in. Right? You all have many years of serving, and it would have been, all right, I did my thing now, so now it's someone else's turn. But you stepped up again, and here you are. So myself, I'm also a 30, I guess close to 30 years now in South Jersey family. 3 of them right here and 1 of them over there, right? And I want to say thank you to all of you. Right? Being a kind of a public servant myself, I understand how difficult it can be. And there's no exact science to what's happening right now. So we're doing the best we can. I know Dr. Mads and her constituents are doing the best that they can to follow whatever the sciences are, and at the same time, look out for the best interest of our children. Right? I understand, I can say, in all fairness and honesty, I know them personally, and I know them outside of the school, and I know where their heart lies and what they're looking to do. So every move is not going to be perfect, we know, but just know that for my little bit of support I can offer, you guys have my support, and if there's anything that we can do, you know, just don't hesitate to call on us. All right?
Thank you.
Thank you.
Thank you. Is there any other public comment?
My name is Nicole DeCampo, and I reside in Scotland. I have a little speech, and I'm not going to say it because it's redundant to what she said. I have a daughter with prepared for also. I just want to know next week, are the kids eating snack outside? My daughter can't even open her snack because she's shivering. She also has OT issues, and it's just not right. So I just want to know, are you guys planning on having them come inside for snack? Because it's too much for them. I just want to know.
Thank you for your comments.
So I know just in speaking to the elementary principals, the rule that they went by this week was if the weather conditions permitted kids to go out for recess, then they were also able to have a snack outside. As we move forward to next week, we are looking to find the spaces so kids can have snack inside, but if you have a day where it would be comfortable for outdoor snacks, that would also be considered. But I'd encourage you to reach out to your building principal. I know that I told a couple people this evening, so we could also talk about this on, just to hear your ideas. I also want to go back to a comment that you made earlier regarding the masks. The article that I sent from NPR was recommended to me to share with the community. And I know that everyone is in different positions regarding the masks, but it was pediatricians who suggested that those type of masks could be beneficial at this time when we have this highly contagious variant. And it's not my recommendation, but it was the recommendation of a pediatrician. So I would suggest that you ask your pediatrician. And I hear that you have a medical background as well, but the doctors are also saying that. It's not my background.
Thank you, Dr. Moore. Are there any other public comments at this time?
Good evening. Hi, my name is Mike Polo. I live in Scotch Plains, New Jersey. I'd like to first start off by thanking the teachers and the school administrators in this district for the last 2 years for what you put into the effort you put in. But I'm here to talk about the fact that the children are eating outside. On Tuesday, it was 27 degrees when the children were outside eating. That, to me, is completely unacceptable, regardless of whether they're capable of going outside for recess or not during that time period. The other thing I don't understand is why we moved to a single-session school day this entire week. It does not make sense to me, specifically based on the numbers that we're seeing from the CDC. And I'll give you a specific number, and that's 830. As of December 29th, 830 people under the age of 18 have passed away from COVID. It's a number I don't like, it's a number I don't want to see, but that tells you a very important thing. Children with this virus are resilient. They're not being impacted as badly as older people or, our elderly folks. You listen to Dr. Fauci this week, he was coming out and telling people that, people who are getting this Omicron variant, it's very mild. And I know they're coming out and they're saying pediatric hospitalizations are going through the roof right now. But I haven't seen any statistics from them stating whether those are because they're going in for COVID-related specific problems, or they're going in because they broke their arm, and while they were there, they were admitted and tested and apparently had COVID and didn't know about it. Those numbers could be severely flawed, and we have media that's basically taking those numbers and they're manipulating them and making people panic. So I'd like to see that we move back to full days next week. I'd like to avoid, a remote learning environment if we have to. I understand that the district is challenged right now with finding people to come in and teach because, our teachers are getting sick as well and they're just as vulnerable. So I think, in my personal opinion, I don't want to go back to remote, but I think a smarter decision may have been to go for a week or two of remote, only because for the teachers that are asymptomatic or have mild conditions and are capable of teaching, they can continue to teach the students. For my daughter to go to school in first grade and have a substitute teacher for a half day, she's better off staying home. She's not really going to learn a whole lot doing that. And that's all I wanted to say. Again, thank you for your time, thank you for letting me speak, and I wish you all a happy and healthy new year.
Okay, give me your comment.
So on the remote option, we don't have an option. That's the short answer. So the Department of Health and the state of New Jersey dictate when we can and cannot use the remote option. We do not have the luxury of just flipping a switch. We would love to, but we can't. So when the Department of Health sits down with our administration, they determine and guide the district with what we can and can't do. And if they do not declare and give us the ability to do remote, we cannot do that. That's just the state, that's the executive order that the governor has out there right now that prevents us from doing that, unfortunately. And nobody's gonna agree or disagree. I mean, we can all have our own sides of that. That's just the way that the process works. And I think Dr. Mess alluded next week, the plan is to be full. I think that she described why we've decided, or the district decided this week would be a half days to get some testing in, to make sure that people over the holidays had the ability to get tested to see if there was any lagging going on between Christmas and New Year's and this first part. So the Department of Health recommendation, along with consultation with the district, was to prevent some of that aerosol through eating, just eliminate eating. So try to just do half days for the week, and you'll be able to get some of those test results back, and then you move forward. So next week, the plan would be full, and I think that's a better option than remote for 2 weeks, right? So, you know, as Mr. Carter said, there's no exact science to this. I mean, we've all been sitting in these chairs getting feedback for the past 2 years, both positive and negative, and everybody's doing the best they can based on the information, but the Department of Health is the guidance, and the state relies on the Department of Health to guide the districts. We don't have flexibility to manage our own districts, and I think the violation of that executive order could potentially lose state funding. Potentially. I don't know if that's the...
I think in that particular case, you know, the biggest risk is the days don't count towards the 180 days, and that, you know, the school year is extended. We do see examples where districts were able to go remote, but another compelling reason that we needed to have this week as single session days, in knowing that the nurses were no longer able to do the daily contact tracing. The numbers were so high that there was no way that they could catch up. So for a student in a middle school class, a middle school student who goes to 7 different classes, is that right? For every class, they have to contact trace all of those close contacts. They could take up to 2 hours per student. The stress on school nurses is really off the charts. And they feel obliged to take it very, very seriously, because they want to make sure that they're doing everything they can to stop the spread. At this point, we know, because Omicron is so contagious, that has left the station, that to find all of the close contacts is very difficult. But still, just identifying the students who are positive, identifying the close contacts, counting the days for quarantine, counting the days for isolation is what they're doing. And they're still very much behind, but it's how we're able to move forward and, you know, identify the kids who need to stay home, identify the teachers who need to stay home, so we at least minimize the spread. And that was part of the reason why we also went single session this week.
I think the other part of the public plea is to please cooperate with the school nurses, because we're having a lot of cases where the nurses are not able to contact trace fully because parents or guardians are not responding and calling back and acknowledging. So it's dead-ending at a certain spot. So we need cooperation from the public as well to be able to help mitigate some of these public processes and practices that we have in place. Trust me, there's nothing more that I would like than to have my kids out of the house all day, as well as my wife who's a teacher in a different district. She may have, but at one point I was going to park them outside of the schools in a tent just to sit there with the Wi-Fi away from my house. But, sorry.
Are there any other public comments at this time?
I'm joining Scratch Plains, and I work with high schoolers. I've been here 15 years. And what I'd like to say is thank you for the health protocols that are helping prevent the spread of the virus. We're a community of connected people of all ages. We're families, we're neighbors, we interact because we live together, We're the village, helping each other with our kids, we're working together. For example, as someone helping an immunocompromised loved one battle cancer right now, keeping my kids protected with these protocols protects her. And as someone whose kids have lost someone this year, because indirectly because of COVID, I can tell you that the mental health trauma of continuing the spread because of the inconvenience that some of these protocols are, quite frankly, the mental health is more hurt by people ignoring the protocols or fighting them or not sitting down and listening or talking it through or trying to see what other people's situations are than it is to just buck up, realize sometimes it just quite frankly sucks, so try to keep each other not just alive, but healthy. The trauma of long COVID is real. The trauma of children loving someone or multiple someones who have changed mentally and physically because of long COVID is real. But kids seeing their schools trying to keep the spread down, it's helping their anxiety, it's helping their mental health. So I'll just end, I'm not going to cry, by saying I'm very grateful. Even when solutions are not ideal, even when it is impossible to keep everybody happy, satisfied, or even on this side of the line. Pandemics are impossible situations. So thank you for at least listening, trying, adjusting when you can, and preparing. Because the kids know, they know they're cared about. Especially when the parents are reminding them, this stinks right now, but it's because the community cares. And I want to keep all of us safe on as many ways as they can. Thank you.
Thank you for your comment. Are there any other public comments at this time? Seeing none, I'm going to close the network.
Hi, I'm Christina Becker. I go to SPFBOE. I live near South Place. I just want to say thank you for the half days because it is very anxiety-inducing to go to school and know that a lot of my classmates are sick and we might not be dying, but we are still getting sick and that's not good. And I'm really glad we had half days this week because I was really nervous about going back after break. And, you know, I'm more anxious in school when there are a lot of cases than at home. And it's also, there are students and staff that don't follow the guidelines. And it's really frustrating that this keeps happening. And I won't give examples, but it's really frustrating because I want to go to school full person. I want to go to school. I want it to be normal, but it's not going to be normal if people keep getting sick. We need that to stop first. And I'm really, I'm glad that, you know, the guidelines are there to keep us safe. And that's all I want to say.
Thank you for your comment.
Hi, my name is Erin Benoit, and I reside in Scotch Plains. I just want to say thank you. I can imagine what it's like to be in your position during these past 2 years, and I understand that it's very difficult recently, and I would not want the job. However, I do believe that the way that everybody's reacting to this pandemic and how it's affected our children, no matter what place you come from, it's your place, and it's because of your journey, and it's because of how it's affecting your children or your family. And I think that it would be nice as a community. I recently moved here. This is my first year in the district. And I think there's a lot of different sides, but I do think that what it boils down to again is what's right for you and what's right for your family and your child, and there's not a one-size-fits-all. However, I do think everyone's coming from a common ground of wanting to meet their best choice for their child. And I think that, virtual might work for some, half days might work for some, full days might work for others, and, being back into normal life, full day school without masks might throw people off the edge because they do have a family member at home or whatnot that they're worried about. I do want to give a little bit of information about my journey and my experience. I do have two kids in the district, they're twins. They both have IEPs. They were born at 23 weeks, and my one son spent the first year of his life in the hospital on a ventilator. I will tell you that in 2019, his entire kindergarten class was taken out by the flu, and he landed in the hospital for about a week, and he just had COVID this past week, and he had a fever for about a half an hour. So, and now his brother is unable to come back to school for 2 weeks, okay? And he's an IEP and he's in extensive related services. So he's missing his related services and his IEP services for 2 weeks of quarantine, and he's healthy. He said to me, Mom, I wasn't even sick. He was the one sick. Why can't he go back to school? And the other thing is that they have significant medical issues that impact this, that are impacted severely by this. And I bent over backwards to try to get exemption. My pediatrician didn't want to write a note because he was afraid to lose his license. Not because he didn't agree with me, but because he's afraid to lose his license. So I do have a question, and I know that the executive order is expiring on Tuesday. I'm hopeful that maybe it won't be extended, and that if it's not extended, what is the district going to be doing in terms of these? That's a valid question, because this might be okay for some kids. They're doing it, whatever it is, but this is really impactful for some of them, and this cannot stay. So, and then one last thing about me is I am a pediatric physical therapist, and I do work in pediatric ICU. I was actually wearing an N95 today in the COVID patient room, and I got near fainted, and I had to leave the room. Kids should not be wearing N95s, okay? Maybe KN95s, that might have been a misunderstanding, but N95 masks, fit tested, lots of things that go into it. I work in pediatric ICU. My son has extensive medical history, and this variant is not impacting the children the way it's being portrayed. And it's really frustrating to go to work every day and kind of see reality, and then have to send my kids to school with this on their face, covered. My one son has significant speech delay. It's just that we need to move forward. Okay, thank you. So I would like to know about this if Tuesday comes and goes and the executive order is not continued, what the district will be doing.
What I could say about that today is that we would certainly rely on the district physician and the pediatricians that we speak with. It might not be the time at this high transmission rate for students, but certainly I know that everyone is looking forward to the time when we can drop the masks. So I think we have to just pay attention to the data that we have, and certainly, certainly individual cases.
Yeah, I think the issue with the mask is that the executive order is what's kind of.
Well, if the executive order expires, the district could still follow the guidelines of the Department of Health.
Okay.
The other piece that I wanted to mention is you talk about what you see every day at work. And what I see every day at work is as difficult as this is for all of us. And sometimes when I talk to the adults, sometimes when people share with me what's on Facebook, I feel so depressed. And then I walk through the halls of our schools, and I will tell you that the kids will never fail us. And though it's hard for them, for all the reasons that you've identified, they are so happy to be together. They are so happy to be with their teachers. And it's exactly what they need, right? They've had so many disruptions. We need to do everything we can to minimize those disruptions moving forward. That's what we are all committed to do. We just continue to follow the guidelines and the advice of the medical experts.
Thank you. Mr. Sylvester, how are we doing on the comments? Any more public comment? Seeing none, then we'll close that portion of the meeting and move on to the upcoming scheduled meetings. January 20th, we will have a regular public meeting at the high school auditorium. And on January 24th, the regular public meeting will be at Terry Middle School auditorium. Excuse me, February 24th, pardon me. And at this time, are there any remarks for the good of the order?
Just congratulations again on another 3 years.
Thank you. Thank you.
It does feel good to be back up here again. Thank you for the public and my family for supporting us, for us to continue to do the work in the district. Thank you.
There's no other remarks for the good of the order. I'd like to entertain a motion to adjourn. Thank you, Mrs. Soriani. Thank you, Mr. Murray. All those in favor? We gotta say your name. A motion and a second. All those in favor? Aye. Nobody opposed?